Welcome back to another edition of the Hart2Heart Podcast. My guest today is Dr. Roger Seheult from MedCram. So, Dr. Seheult, welcome to the show.
Thank you so much, Mike, for inviting me.
So I'm really excited to chat with you today. I saw, a lot of your videos online. Like we were just discussing before the show, Dr. Andrew Huberman has brought you up because of the NAC study that you posted. But I also know that through MedCram, you've, educated a lot of different people, myself included. You got some great videos, not just on, preventing the common cold, but red light therapy and some other things that we're going to hopefully get into today. But before we get into that, can you just give the audience a little bit of a brief background about yourself?
Yeah, sure. I was born not too far from where you are working in Toronto, Canada, but moved down to California when I was about 8 years old, did all my schooling education here, became a physician at Loma Linda University School of Medicine, did internal medicine residency, pulmonary critical care fellowship. So now I'm a pulmonary critical care sleep certified physician. I have a practice here locally in Southern California, and professor at Loma Linda and also at the University of California, Riverside in their schools of medicine, and teach medical students and PA students and respiratory therapists.
Interesting. And so how did MedCram start?
Yeah, that's an interesting story. One of the, where I was working, we actually had PA students from Loma Linda used to come out. And they invited me to give a lecture on acid-base medicine. So I showed up without a PowerPoint presentation. And it's just basically a marker and a whiteboard. And in about an hour and a half, we went through. So basically by the end of that, the students went from knowing nothing about acid-base to being able to interpret a blood gas, which was really gratifying. And one of the students turned out to be one of the students on my rotation, Kyle Allred, was really into education. His father actually had educated in a business in that sense, in terms of continuing medical education, and thought there was a future. And he's the one that came up with the idea. We teamed up, made a YouTube channel. I thought it was a really good idea for me because when these students came to the rotation, I could record these lectures, I could assign them, and then we would meet back and talk about them and use our time more wisely. We posted them online. They became very useful for not just my students, but a lot of students. And that's how we grew. Amazing.
And congratulations on your success. I think you're up to 1.6 million subscribers.
Yes.
Is that right?
Yeah, it's amazing.
That's awesome. Did you really expect for everything to blow up like that, or?
Not at all.
Wow. Well, yeah. Again, I think you've educated a lot of people with it. So, and the lectures there are excellent. So, I really encourage people to go to, Dr. Seheult's page and look up his lectures because, they are, very evidence-based, really, informative for people who are into medicine and for people who are just, not necessarily, in medical school or training, but for people who are just interested in medicine in general. So, we were talking about before the show, the NAC study, and, it is flu season right now. So, maybe we'll kind of start off there. Why is it that people get sick more in the winter months and say the summer months?
That's a great question. It's hard to answer that just looking at things empirically, you would think, right? Because in the wintertime, it's also cold. It's also the shortest days of the year. Humidity is different. And yet every year in the Northern Hemisphere, you look at just about any country in the Northern Hemisphere, that we see a increase in flu and viruses in general. So RSV, norovirus, influenza, now COVID is sort of mixed into that as well. It's always at this time. And so it's really difficult to sort of sort that out. What is it that's doing that? When you look at the Southern Hemisphere, and you can look at countries like Australia, you see exactly the same thing, except it's not happening in December. It's happening in June and July, where they have their shortest days of the year. It's also coolest down there, although not nearly as cold in Australia as it is, for instance, in the northeastern portion of the United States. But they have very similar. In fact, that's how we figure out what vaccines to make in Australia, by looking at what happened half a year before in the United States and vice versa. It wasn't until recently that a number of studies have come out, and I can go over those. I think they're actually very good studies that elucidate that the thing that actually is the central aspect of that is making these illnesses go up at those times of the year is the sun, is daylight. And it really comes down to something that I just came into understanding probably about 3 or 4 years ago, maybe about 3 years ago, when I read a paper that was published by Scott Zimmerman and Russell Ryder in Melatonin Research. And the paper was titled Melatonin, the Optics of the Human Body. And what Scott Zimmerman, who's a light engineer, and Russell Ryder, who's a melatonin researcher, put together was just mind-boggling. Connected a whole bunch of dots for me that showed that, in fact, the human body is not just a machine where light is interacting in the eyes, but rather the entire body through the skin. The mitochondria is in tune to this. It was just an amazing thing to see and behold and look at the data. So when you look at that, it's you've got it's a very wide topic that you've got to sort of look at, because not only are you talking about the physics of light and its ability to penetrate, but you're also looking at human physiology and metabolism and mitochondria, which is the powerhouse of the cell, and how those things work, and oxidative stress. So it's a really wide topic to talk about. But basically, at the end of the day, sunlight has an effect on our human body that affects our ability to produce energy, to be efficient, and to have good immune systems. And when sunlight goes away, those systems don't work as well. They become kind of like older in the mitochondrial theory of aging. And that opens us up to a whole bunch of diseases.
You know, it's really interesting there, because that was an extremely good answer. Thank you so much for that. But, you know, not one time there did you mention, vitamin D. And we do know that, vitamin D has been shown through supplementation to reduce the incidences of, respiratory infections. But, obviously there's something else going on there. So, is it the near infrared light that is, penetrating the skin and inducing more of the mitochondrial response? Or is it something from the UVA or UVB rays? Like, what is it specifically, about the sunlight, other than the vitamin D that really helps people, not get sick?
So that's an excellent question. I'm a big believer in vitamin D. I supplement myself with vitamin D. I think vitamin D has benefits, and I think we should do it. But the product, or the thing that produces vitamin D from the sun, is this tiny little sliver, maybe about 2% of the photons from the sun, in the ultraviolet B spectrum that is producing vitamin D. So I do believe vitamin D is important, but there's this whole swath of the electromagnetic spectrum that we're talking about. Over 50% of the photons coming from the sun are in the infrared spectrum. This is light that's invisible. You cannot see it. It's beyond red, and it's very, very important. So I look at sunlight as a whole package deal. So what we try to do as scientists oftentimes is to break down things into things that we believe are beneficial. But what we miss when we do that scientific reductionism is we miss how things interact with each other in the same organism. So I believe, and there's some studies that back this up. There was a study that was done out of the University of Edinburgh. And what they did during COVID is they looked at the United States in the wintertime, but they eliminated the southern portion of the United States where people could actually get vitamin D from the sun because the sun was high enough in the sky. So this was probably around the parallel of around where Tennessee is. So everywhere north of Tennessee during this period of time was not getting any sort of ultraviolet B radiation to make any sort of vitamin D. At the same time, they looked at England. Also, pretty much the whole country of England at that point was not getting enough sunlight to make vitamin D. And they also looked at Italy. Again, the whole country not making enough vitamin D at this particular point in the wintertime during COVID. And what they found was that when they measured ultraviolet A radiation, and correlated, using it as a surrogate for the amount of light that was hitting that particular area, they found a very interesting association. They found that the more light, or the lower the latitude there was in that country, the lower the COVID-19 mortality. In other words, in a process completely independent of vitamin D, they found that sunlight improved mortality in COVID-19. I had the privilege of teaming up with Margaret Skutch, who is a geographer at the university in Mexico. And we looked at all of the countries of the world during the COVID-19 pandemic at its height. And if we looked at just the countries that had a 50% overweight rate in their country, there was a definite association between latitude, which is a surrogate of sunlight, and COVID-19 mortality. The more sunlight, the less COVID-19 mortality.
Interesting. And so the sun produces, as we know, it's blue, green, and then yellow, and then red has, the red light, and then also near infrared light, mid infrared light, and far infrared light. But what people mostly, have been focusing on in red light therapy is just including the red light and the near infrared light. But from what you're saying, it's more the UVA and potentially UVB rays that could be the more efficacious factor overall, would you say?
I would say actually infrared light.
Infrared light, okay.
Infrared light is actually the area that we're missing out on most. We've got a number of studies that have looked at this, and near
infrared light, like specifically, or all three spectrums or all four spectrums of the red light.
Okay, so I'll give you an example. I think it's near infrared light. Specifically, we have data at 940 nanometers. So there was a study out of Brazil that looked at patients that were sick enough with COVID, for instance, and we can do the same thing with influenza, but sick enough with COVID that they had to be admitted to the hospital. So they admitted 30 patients to the hospital, and these were sick enough to be admitted to the hospital, but not sick enough to be in the intensive care unit, between the ages of 18 and 60. And what they did was they made this jacket that they put on all of the patients, and on the inside of the jacket they had these LED lights specifically tuned to 940 nanometers. This is in the infrared spectrum, not ultraviolet A, not ultraviolet B, infrared. And you could not see it. Even when they were on, you couldn't see it because it's beyond the visual spectrum. And they randomized these 30 patients to whether or not the switch was on or the switch was off. That's how well the randomization was. Well, what they found is that in almost every single endpoint that they had, these COVID patients were superior to those that had the jacket switched off. So those that had the intervention group with the light switched on, what did they have? They had oxygen saturations that improved faster. They were able to take deeper breaths, stronger breaths more quickly. Their heart rates improved faster. Their respiratory rates improved faster. In fact, all of these things work together to the point that these people that had these jackets switched on actually left the hospital 4 days faster than those that didn't. And that was statistically significant.
Wow. And so when you're measuring that, is it joules per centimeter squared that people are looking at when you're looking at near infrared light?
Yeah, there's many different ways of measuring it. They actually, in the study, they were very specific about exactly how much light this was. They talked about the lumens, the energy, exactly the type of wavelength, how many there were, the area over which they covered. So there's enough information, for instance, in that study that you could be able to get the information to replicate such a jacket. But remember that there's almost an infinite number of wavelengths that we're talking about. It depends on how far down you want to go. But the sun has all of those wavelengths.
But if we're talking about how much, say, near infrared light someone needs to, get those desired effects that you were just describing, or to try to, prevent a cold, or try to, treat a cold, or treat SARS-CoV-2 or COVID, how much did they find, or what was sort of like the therapeutic dose? And, I know that some people listening to this, may not be, quite as knowledgeable about red light and near infrared light, but for people who are listening, like in layman's terms, like how much near infrared light do people need to get? Like what's the optimal dose in order to get those desired effects that we're talking about?
Excellent question. And the idea that you have to understand when you're talking about red light, infrared light, is something called a biphasic response. Biphasic response. And what that means is that there is a definite improvement in efficacy when it is early in the phase. When you turn it on, it reaches to some sort of efficiency. And then further stimulation after that has much diminishing marginal utility. And let me put it into simple terms. Glenn Jeffrey, who does many of these experiments in his lab in London at UCL, has seen, whether it's in mosquitoes, whether it's in bees, whether it's in humans, that after about 15 or 20 minutes, the maximal effect has already taken place, and any further stimulation is not going to lead to that much more effect. In this case, in the Brazil study that I mentioned, in this case, they did it once a day for just 15 minutes. And at the end of 7 days, they were able to notice that big of a difference. So the answer to your question is not very long at all.
Okay. But like when they had the jacket on, like from my understanding, if you want to, calculate, how much you're getting in joules per centimeter squared, it would be, the power of the wattage of the lights, and then the time spent, under the lights, and then also to the distance. So when you have a jacket on, obviously the distance is minimal,
very small,
essentially zero, right? So it would be like fairly powerful. Most people, I think, don't have access to a jacket. They're using some kind of like light therapy device, but essentially, if someone did have, I'm not paid by Kala or anything like that, or, name whatever, Huga or whatever product you're using, like, how much time should one spend in front of it in order to get that effect? Would it still be 15 or 20 minutes, or is that kind of difficult to calculate?
It's very difficult to calculate for a number of reasons. We don't know. See, this is the problem that we have with sort of the infrared saunas, is that we don't know which wavelengths cause what. And that's the thing with this study, is this was at 940. There's some infrared lights that use 1070. That's another area. Obviously, it depends on the effect that you're looking for. There's some evidence that seems to think that any kind of infrared light in general is going to improve the efficacy of the mitochondria, which is what you're looking for, the effect that you're looking for in this case. But we don't know. And we could literally be here for the next decade studying all of these effects at various different wavelengths and seeing whether or not that is an effect and a change. What we do know is that getting out into the sunlight, the sun doesn't change. On a clear day, the sun is the sun. It has all of the wavelengths. And that's why I've really been an advocate for people to get out into the sun when they can.
And so is there a difference? We talked about UVB rays, inducing vitamin D synthesis. Is there a difference between supplementing with vitamin D and then getting UVB rays from the sun?
Yeah, there was a study that I saw recently, 2 studies actually. One that showed pretty conclusively that if you want to just raise the level of vitamin D in the blood, that probably the more effective way is to actually take a vitamin D supplement rather than getting out into the sun. However, there was another study that seemed to indicate that there were more efficacy of the vitamin D when it was obtained from the sun than when you took it orally. And I have to go back and look and see exactly where that study was, but it was a study that was just recently published within the last year.
Interesting. Okay. And then one question I had for you too. So just coming back to why people get sick in the winter, there's one kind of sort of paradox that I find there. So we understand, from my understanding anyway, that, cold plunges and exposing yourself to the cold can actually be helpful for your immune system. So if someone, if they have a cold, shouldn't they avoid doing cold plunges? Shouldn't they avoid getting a cold shower? Or what are your thoughts on that?
So I think it depends on the timing and how you do it. In my estimation, when I've seen this, the place for cold is right after hot. So a very typical protocol that is been used for hundreds of years actually, is to do hot for about 20 minutes, followed by a very short amount, maybe less than a minute of cold. And what this tends to do is the heat is causing the body temperature to go up. We have very good data that shows that when you heat up the core body temperature, even up to the point of 38 degrees Celsius, which is just barely a fever at that point, that's the cutoff for a fever, that we see an increase in a lot of the transcription factors that are involved in the innate immune system, in many different ones. And so what you're doing is you're activating the innate immune response, which is the first defender against any type of virus, whether it is respiratory or GI. And then what happens is when you go into the cold, it's almost paradoxical, but what you're doing there is you're clamping down on the peripheral vasculature in the outer portion of the body. And what that tends to do is after you get out of the heat and you close down that peripheral vasculature, the blood vessels, is it prevents the body from dissipating that heat, and you hold on to the heat longer. It also causes a fairly good vasoconstriction of the blood vessels. And what that does is it tends to demarginate the white blood cells, gets them out into the circulation and doing what they need to do. So if you think about this, doing a long time with hot to try to bring the temperature up and then packing it off right at the end with a cold plunge that's about a minute or so. Think about what you're doing. You're activating the transcripts in these immune cells that are increasing their ability to fight the viral infection in the innate immune system. And then what you're doing right at the end is sending them out into the circulation. So you're priming them and then sending them out into the circulation when you do hot and then cold. So hot for about 20 minutes, cold for about a minute. And then if you're not done, you want to do it again, do another hot for 20 minutes, 15, 20 minutes, and then another burst of cold right at the end. This has actually been the protocol that we've seen in multiple cultures, multiple societies for hundreds of years. This is what they did, for instance, back in the 1918 Spanish flu pandemic in the United States in the Northeast in sanitariums. This is what they have done in saunas in obviously Northern Europe. And they even actually use the tree branches or the leaves. And what's that doing? That's hitting the chest, hitting the back. It's a part of demargination, trying to get those white blood cells into circulation. It's actually quite interesting to see anthropology sort of substantiate what we know now pathophysiologically.
Yeah, that is very interesting. When something that was done in ancient history, now we have the science to figure out why they were actually doing it. And I think also too, both those methods, particularly if you go back and forth between the heat and the cold, induces I know people say this word differently, but autophagy or autophagy.
Yes, autophagy. Yeah.
So does that mean that getting in the sauna is the same thing as your body like producing a fever?
Actually, that is exactly correct. So what they did a scientific experiment in a paper that was published a couple of years ago where they looked at this idea of fever. And what they did through a process of elimination is that they tried to understand why were these transcripts increasing in number when the temperature went up. It wasn't because the mRNA was hanging around longer. It wasn't because the proteins were not being degraded. It was simply because of the temperature of the cell. Literally, the temperature of the cell by itself was increasing the amount of transcripts made by DNA polymerase in the nucleus of the cell as it was reading off the DNA for the genes for these STAT2 genes that are actually involved with the innate immune system. So yeah, it doesn't really matter how you increase the body temperature. Just by simply increasing the body temperature, you're increasing the innate immune system. And by the way, this has been known for a long time. In fact, in 1927, Wagner Jauregg, who was the recipient of the Nobel Prize in medicine, received that prize because even before the advent of antibiotics, he was curing people of neurosyphilis. He was a psychiatrist. He saw that people in his psychiatric units were improving from their neurosyphilis when they had a fever. So he took people that were infected with malaria, which they did have the cure for at the time. He purposefully injected it into his patients and watched them very carefully. And when the fevers came, these high fevers actually stimulated the body to eliminate the neurosyphilis bug, which we know is a bacteria, a treponeme bacteria. And then after that was done, he simply cured them of the malaria, and they were cured of both. So you can imagine at a time before we had antibiotics, what an amazing discovery this was. Ironically, the very next year in 1928, we have the discovery of penicillin, and it changes history. We instead of the science at the time looking at ways to increase the body temperature, either by hot baths or heat closets or injecting foreign proteins into the body, these were all things that were being looked at in research at the time. We now had the advent of antibiotics and medications that could treat these bacteria, seemingly without a lot of the side effects. But we now know today that there are risks with antibiotics. I mean, it can really contribute to messing up your microgut biome, the microbiome of the gut, not the least of which is, C. diff colitis, which we see often in the hospital. That's probably the biggest one. But we don't know down the line what's going on when we are giving antibiotics. So I guess the key here is that with everything that we do, everything in medicine, there's always a risk.
What are your thoughts on treating fever? Because a lot of people, as soon as they, hit a fever of say, 38.0, they start taking Advil, they start taking Tylenol. Is that a mistake?
It depends on the patient. I generally don't use Tylenol unless it's gotten substantially higher. Here's the thing. What are the risks of having a fever? So seizures is a risk of having a fever. If somebody is prone to having seizures, that's something that you might have to be sensitive for in that person. If you're treating a person who has a high heart rate, having a fever is going to increase even more of that heart rate. So these are the types of complications that we typically see with fevers. I typically don't see those complications unless they get over 102, or as we would say in Celsius, about 39 degrees. So once it starts to get up to that point, then I start entertaining that possibility of treating a fever then. But up until that point, I've never seen a complication from a fever less than 102 or 39 degrees Celsius. In fact, there was a study that was done looking at the secretion of interferon. So interferon is a very broad family of proteins that interfere, aptly named, with viral infections. And what do we see? When we take lymphocytes and we incubate them in something called mitogens, which are proteins which stimulate the immune system, proteins that look very similar to foreign substances, that we see a 10-fold increase in interferon when the temperature hits 39 degrees. So that's why I'm really reticent to treat a fever in somebody who I know has an infection, because I feel guilty. I feel like I'm crippling the body's own immune system, which I very much need. I need that body's immune system's help in treating the infection that I'm treating.
Interesting. So regarding the use of sauna and the practice of it, like, is it okay for people to use the sauna and to induce, say, like a fever, we'll call it a fever, or say to go up to, say, 38 degrees every day, 38.5, is 39 okay? Because, people are trying to induce heat shock proteins, we know as well. And, is there a limit, and how should people use the sauna safely in order to, get the benefits, but also not overdo it?
Yeah, and that really is on an individual basis. So the older that you get, or even so very young and very old are the ones that are most susceptible. Very young because their blood vessels are very, very flexible. So they could go into the sauna and their blood vessels dilate, and all they have to do is run up some stairs and they could faint and fall after that. Whereas on the other side, the people that are older, they can become very dehydrated very quickly. And because their blood vessels are not very flexible, they can also become faint and have issues with their heart. So I would recommend starting off slow and doing it maybe not for a full 20, 30, 40 minutes, maybe doing it for 5 or 10 minutes and just sort of getting accustomed to it. But no, I believe it's actually very beneficial. We have studies. It's not even a matter of what I think. We have studies that show that people who do sauna on a case by case, or actually on a dose response curve, that the more days per week that you do sauna, we see that there is a reduction in mortality. Now, people may say, well, that's just an association. We can't say that there's causation. But remember that when you see a dose response curve, that means that the more times you do it, the more the effect seems to be. That's very suggestive, according to Bradford Hill criteria, that what we're seeing there is causation.
Yeah. And I don't really buy the healthy user bias because of what you just said as well, because, again, the more you use it, the more of a response that you're getting overall. So, just to be clear, like, would you have a temperature though to say, like, not go past daily? Like, is it 39 degrees? Is it 39.5? Is it 38.5? Like, what is the sort of optimal temperature that people should be looking for? Because I am someone who, I'll check my temperature before I get in the sauna, and I'll check my temperature when I get out. I usually go up between 38.5 to 39.3-ish, something like that. And I do it basically, every single day. Like last year, I think I did it like 340 out of 365 days, something crazy. So, like, am I overdoing it? And should people, like, what is the temperature that people should be looking out for when they're sort of in the danger zone, so to speak?
Yeah, if you're going above 39, you're probably not getting much more benefit for the temperature that you're getting. Now, if you would have asked me this question a year ago, I would say, yeah, you need to get up to 39. That's really important to do that because of that study that I mentioned where we see a 10-fold increase in interferon at 39 degrees Celsius. But hey, there's this study that I discovered and I was reviewing that we actually talked about on our MedCram channel that shows that even going from 37 to 38, there is a dramatic increase in the transcripts of STAT2 and other innate immune system modulators, that I believe that even if someone was only able to get up to 38, I think that would actually have some pretty good benefits right there. So certainly going to 39 is going to be great. I think going past 39, which is about 102.2, that's you're probably running into a situation where you're getting more risk now than you are benefit, especially in people who might be susceptible to some of these complications, for instance, seizures and fast heart rates.
But safe to go up to 39 degrees daily, you would say?
For the general population, there may be some people that, if they have a seizure disorder, this may not be a good thing for them to do. So I would check with their physicians and make sure that they're not one of those people that might be susceptible. And again, I wouldn't just jump in and go to 39. I would take it up slowly. I do sauna as much as I can. I have one too. I hit that thing to 190 degrees nice. And I'm in there. So that's Fahrenheit. I don't know what that is actually in Celsius, but it's hot, and I put a lot of that water on there, that steam it up. It really gets hot. I sweat, and that's what your body is doing there. Is trying to cool you down, and so that's one of the things that makes it difficult to get to that temperature.
Yeah, what I have is a far infrared sauna, but then I have a Sauna Space. I don't affiliate with that company in any way, but Sauna Space heat bulbs. So there's 4 of them. And so that makes it, incredibly hot. So I'm only in there actually for about 16 minutes. And in about 16 minutes, I can get my body temperature easily past 38.5, sometimes even up to 39 degrees. So, that's what I do. And then I get also the benefit of, the red light and near infrared light when I'm doing that as well. We haven't discussed heat shock proteins too much here. And, that's kind of been, a buzzword. I think, Dr. Rhonda Patrick and Dr. Andrew Huberman have, discussed that quite a bit at length on their own podcast and also on Joe Rogan, on the Joe Rogan Experience podcast. So, is that something that you think is beneficial for people?
Yeah. So this is this thing about hormesis, right? So if we look at philosophically what we've become as human beings, we've used our technology to make ourselves comfortable. We have lights inside. We have food whenever we want. We have light. We have heat, and we have cooling. So we have everything. So now what we've done is we've stayed inside the box, and we haven't exercised and used what the body has used for, since it's been around, the extremes to make sure that our proteins can be folded correctly. And we have these enzymes that are induced at very high temperatures and very low temperatures. I know they're called heat shock proteins, but these heat shock proteins are also activated when you go into a cold plunge. So it's basically making sure that these proteins are folded in the correct way, because when they're having these extremes, they can become denatured. So these heat shock proteins go around making sure that these proteins are folded in the correct way. You can already tell just by me saying that how beneficial these heat shock proteins would be in a regular daily occurrence, making sure that everything's working, especially when we are high energy machines that can be assailed with entropy. So things are being used for a long period of time. Proteins become denatured. Where's the heat shock proteins? Well, they would normally be there if we were being exposed to high heat or low heat, and they're not there because we're in a room that is at 72 degrees the whole time, and we don't get the benefit of that. So going out, even if it is, artificial, because we're not living in, an environment that we did 500 years ago where we had huts to keep ourselves warm from the cold and vice versa. Going out and doing these things on purpose. So, intentional heat, intentional cold. These are things that I think can help give us the heat shock proteins that we're no longer experiencing in modern life.
And there was a study that I saw that came out, I think it was late in 2023, maybe December 2023. And it looked at various different methods of improving cognition, reducing the incidence of Alzheimer's disease and various neurodegenerative disorders. And I was shocked when I saw it, because I always thought that there was nothing that was going to be exercise in terms of reducing, the incidence of Alzheimer's disease and improving cognition and slowing, mild cognitive impairment. But it said that, photobiomodulation or red light therapy, so that's red light and near infrared light, was actually the best method by far. And so, when you look at studies like that, is it the heat shock proteins, or is it just more or less like the near infrared light that's doing it? Because I imagine in these studies that they didn't actually use heat, they just used the red light. And so is it more or less just the red light and the near infrared light that's, providing these effects?
We don't know. And again, this is the thing that it's our idea of reductionism. So this is one of the things that actually got me into this whole field is as being a pulmonary and critical care specialist, is asking this question, is why is it that people, when they come into the intensive care unit, why is it the ones that have very low vitamin D levels have the worst prognosis, whereas those that come in with regular normal vitamin D levels or even high vitamin D levels have a much better prognosis? Yet at the same time, when we supplement people in the hospital with vitamin D levels, we don't see that dramatic difference between the two. And I think it's the same thing here. Is the heat shock protein associated with the light, which is associated with the exercise? Does exercise actually increase the heat and cause heat shock proteins? Is there something about the light that's causing the production of hormones or antioxidants? I think all of those are probably true. I think one thing that we can probably know for sure is that whatever our understanding is of the human body, it's not yet complex enough to be able to tell exactly what it is that's going on. It's more complex than we think.
Yeah, just one, comment on that. I will say, like, if I exercise, say I do zone 2 cardio, I put my treadmill at 12 at 3.3 miles an hour, and I exercise for about 45 to 47 minutes like that. I'll only raise my body temperature like maybe 0.3, 0.4 degrees. Like, it's really not that much. But if I go into that sauna with the sauna space bulbs for like 16 minutes, like I'm getting like, 2 to 3 degree responses. And so, it seems like you get significantly, hotter, and you can, raise your body temperature significantly more by using something like a sauna than say from exercise. So, it is interesting when you compare the two and you see this like dramatic difference with a sauna versus say like exercise, because I don't think that exercise can really raise the body temperature that much overall. Now it's different if you're like running outside in Arizona heat, maybe you will, but if you're inside and in like a air conditioned house like I am when you're on your treadmill, it's a little bit different.
Yeah, and it may not be that the red light is doing everything through just temperature elevation, right? Because, for instance, we know from Glenn Jeffrey's work at UCL that the addition of red light to somebody taking a 75-gram glucose load will actually reduce the peak from that glucose load just by putting red light on the back. Like, how's that working? There's obviously several theories. Is it the red light is causing some sort of stimulation of cytochrome oxidase to speed up the mitochondrial metabolism? Does it have to do with structured water? Who knows the answer? The fact of the matter is, we know that red light increases the efficiency of the mitochondria. We know that because glucose is reduced, and in that study, statistically significantly, exhaled carbon dioxide was higher. So when we see that, we ask ourselves, why is that happening? What's going on? The other theory, of course, is melatonin, right? So we have very good evidence that melatonin is actually produced in orders of magnitude higher quantities in the mitochondria than it is in the pineal gland in our human brains. And so that's actually goes back to Scott Zimmerman and Russell Ryder's paper as well. And maybe that has an effect. If you're having more antioxidants, you can now have a much more efficient machine. And if you put that together with the entire mitochondrial theory of aging, you are essentially turning the clock back on your powerhouses in your cell. And what would we expect to see there? We'd expect to see exactly those things. It's interesting, by the way, this paper that I was talking about in terms of temperature elevation and 37 degrees to 38 degrees, they actually propose in that paper that the reason why people who are older were more susceptible to COVID-19 is precisely because of the fact that younger people with more intact innate immune systems are much more able to mount a febrile response and therefore get rid of the virus faster.
Very, very interesting. So just coming back to the common cold, vitamin D is something that's pretty well known that people take, especially in Canada during the winter. A lot of people will, get suggested to, take vitamin D to prevent, some kind of respiratory illness. But what other things can people take to prevent the common cold?
Prevent, treat, pretty much the same thing. Let's start with the basics. Let's start with sleep.
Yes.
Very, very important is making sure that you're getting enough sleep. There was a study that was done at the University of Pittsburgh, and they used the opportunity of the flu vaccine to show what was happening. They divided this cohort into those that got 7 to 8 hours of sleep or more, and those that got less than 7 hours of sleep. And they found that after the flu vaccination that was standardized, they were able to show that those that had better sleep patterns, greater than 7 to 8 hours of sleep per night, had almost twice the number of antibodies against the specific epitopes of the flu vaccine. Now, that eventually caught up about a month later, but this is the problem, is timing is everything, right? So if your immune system is able to mount an immune response faster and higher, then obviously you're not going to get the symptoms of the cold. So having a good night's sleep is really important.
What about the study from 2015 where I think it indicated that if you get less than 6 hours of sleep per night, you are 4.2 times more likely to get the common cold?
That may be a different one. The one I was looking at was the influenza with the vaccination. But yes, no, there are studies like that as well. So there's another study that looked at influenza, and this was done out of the Harvard Kennedy School. And as we talked about at the very beginning, it's difficult to tease out sunlight versus cold weather versus humidity, right? Like which one of those? And there's actually a study that was done in 2000, looking in the autumn of 2000. And what they wanted to know was this thing is the surge dates in Europe of COVID-19. Was it based on humidity? Was it based on temperature? Or was it based on latitude? When they did the analysis, there was absolutely no correlation with temperature. There was absolutely no correlation with humidity. There was a beautiful correlation with latitude. In fact, as the sun started to peel back to the southern hemisphere in the autumn of 2020, the countries that started to get pinged off one by one, it was first Finland, came down the continent, and the last country was Greece. So switch that around to this Harvard study when we're looking at influenza now, not COVID-19, but influenza. And every year we see a peak of influenza deaths exactly at the same time here in the Northern Hemisphere in the United States. It's in December and January. We're going through it right now as we're tape recording this. I'm having patients in the ICU right now. Half my unit is filled with people with very severe influenza. So this is not a surprise. We know when it's coming. Well, how do you separate out cold, humidity, and lack of sunlight? Because they're all happening at the same time in December and January. Well, in 2009, we had a very interesting event. We had this 2009 H1N1 pandemic that occurred with this very particular type of strain of influenza. But it didn't come in December and January. It actually came in late summer and hit a lot of people. So what that enabled scientists to do was to look over that year, because that year was actually pretty cloudy. There wasn't a lot of sunlight that year. And they were able to see a lot of data points that they would not have been able to collect. For instance, people were getting influenza when it wasn't cold, it was warm. People were getting influenza not when it was lack of sunlight, but there was sunlight in some parts of the country, but not in other parts of the country. So in other words, 2009 kind of pulled back the curtain in terms of these variables so that we can now put these things in focus. Really, is it humidity? Is it temperature? Or is it sunlight? And so what they did at the Harvard Kennedy School, which is actually not the medical school, right? It's the US government political policy portion of Harvard University. They looked at solar radiation data and they looked at the flu index. And when they did so, the conclusion was very clear. And I can quote exactly what their conclusion was. They said, and I quote, "Sunlight strongly protects against getting influenza." That was the mind-blowing thing when I saw that. This was sunlight. So ultraviolet, A, B, infrared, they put it all together into one packet. And they said, look, the bottom line is if you get out into the sun, that strongly protects against getting influenza. So it was very clear for me. When I see spikes going up in the wintertime,
and why is it? How much sun do you need to get in order to get that desired effect?
Yeah, so I believe that we're seeing that same effect in the patients that were in that Brazilian study that was a randomized, placebo-controlled, double-blinded study. And that was only 15 minutes a day. Here's what I think is actually happening to us on the personal level. Up until about October and November, and you can look at this very easily depending on where you live. When you get out of work at 5 o'clock or when you're going to work at 8 o'clock in the morning, up until about that period of time, the sun is still up after you get off of work and the sun is coming up before you go to work. There's a period though, and you and I know this, probably around October and November, where there's whole swaths of time where you go into work without seeing the sun and you're coming back home after the sun has set. And so you could go weeks without seeing the sun. All you need to do is to be able to get 15 minutes a day to see that sun. You know, there's a study that was done in Sweden where they looked at women, 20,000 women over 8 years, and they divided them into 3 groups. Swedish women that avoided the sun, Swedish women that went into the sun, but not a lot, and Swedish women that avidly went after the sun. And you know what they found? A dose response curve where the women that actually avidly went into the sun had lower all-cause mortality, had lower cancer mortality, had lower cardiovascular mortality. And it wasn't just a small amount of mortality. It was the difference was on the effect of smoking. So what I mean to say is that those women that went out into the sun and smoked had the same level of mortality as women who avoided the sun and did not smoke. So think about that. What do we do to people who smoke at work? If they want to smoke, what do they have to do?
Go outside.
They've got to go outside. Exactly. So we should be following them outside to get the benefit because they're actually getting a benefit that offsets the risk that they are getting from smoking if we were to read into that. Now, that study was done I think in 2016. There was just another study that was published. This was a UK biobank study, 10 times the size of that one. And it included both men and women. And what were the results? Almost exactly the same. 30% reduction in all-cause mortality, reduction in cardiovascular mortality. These studies have been published over and over and over again, to the point now that even dermatologists are recognizing this. Dr. Weller, Richard Weller, who is a UK dermatologist, published in the Investigative Journal of Dermatology a paper titled Sunlight, Time for a Rethink. And he actually quotes a lot of this data. And he says, look, we've been saying for years as dermatologists that no amount of sunlight is actually beneficial. Any amount of sunlight is detrimental, and you need to avoid it like the plague. And he's saying, you know what? We cannot avoid these epidemiological studies that actually show that there is a benefit to getting out into the sun. So what do I recommend to my patients? And it's so difficult. I know it is. And people look at me and say, you're in Southern California. Look, I've been to Alberta, Canada. I've been to Toronto. Okay. I know the sun comes up. I've seen it even in December. Look, how do you get black ice? Okay. London, Ontario, how do you get black ice? The only way you get black ice is when it snows, and then the next day the sun comes up and melts it, and then it freezes, right? How do you think that snow is melting? It's melting because of infrared radiation from the sun that's penetrating, yes, even in December, and it's melting that snow because that's exactly the wavelength that water absorbs is infrared, and it's melting. And so that's that specific type of wavelength that we're talking about. It is even more important in the wintertime to get out into the sun because that is exactly the time of year that we're most lacking.
And that's interesting too, because, we all know that the sunlight, especially if you get it in your eyes, this is basically what, Andrew Huberman is almost famous for is, for improving sleep and for improving your overall mood, health, and energy. And so if you don't have, energy, and if you don't have the best mood, you're also not going to partake in things like, cardiovascular conditioning and other things like that. So, I think that there's a snowball effect there as well, which is very interesting.
There is a snowball effect. There's no question about it's additive. A lot of these things that we're talking about have not side effects, but side benefits. But let me just to nail this point home to you, and I think this is really important to understand. One of the things in nature that we see that probably more than anything else will multiply the effect of infrared light on the human body are plants and trees. And this is for the simple reason that leaves, plants, trees highly reflect infrared light. Just go onto Google and you'll see it for yourself. Type in infrared photography and you will see that in the in the spectrum of infrared photography, leaves, plants, these things are highly reflective. So you could go outside on a summer day or on a sunny day in a city and get a certain amount of infrared light. But let me tell you that that amount of infrared light is going to be much higher if you're going outside in the country around trees and shrubs and greenery. It's the reason why that if you go out on a hot summer day and you touch something metal, you're going to burn your hand. But if you touch a leaf that's been sitting in the sun all day, it's not even hot. It's because that leaf is so well designed to reflect infrared light that if you were to go under that tree, you know this from experience, right? The coolest place in a garden is where? It's under a tree, because that's where all of that infrared light is reflected away. So based on that, they did a study that's an amazing study. A lot of times we've known this for years, that people who live in green spaces have less diabetes, less cardiovascular disease, less mortality. And for many years, the naysayers have said, well, it's because people who live in green spaces are usually more socioeconomically well off. They have better access to all of these things. That's the reason why people in green spaces live longer. Well, they just did a study, completed the study this year it was published. It took about 2 or 3 years to do, but in a 4 square mile area in southern Louisville, Kentucky, they took this area, same socioeconomic place, it was standard. And what they did was they brought in, now get this, they brought in 8,000 to 9,000 mature trees with the leaves already on them and planted them in this 4 square mile area. That's all they did. They had no exercise programs. They did not infuse the area with guaranteed salaries. They did not increase the social. That's all they did was they just planted trees. That's it. What they did before they planted the trees was they measured something called highly sensitive CRP, HSCRP. This is a surrogate for inflammation. And when we see high levels of CRP, we see increased levels of stroke, heart attack, cardiovascular disease, et cetera, et cetera. So what do you think happened when they measured it after they planted 8,000 to 9,000 trees, mature trees in South Louisville?
I imagine it decreased.
There was a 13% reduction, which is on par with what you would expect to see with exercise, which is what you would expect to see with any kind of lifestyle modification. Just planting the trees was enough to do all of this.
That's insane. I think boron and curcumin are both things that can reduce CRP as well. I'm not sure you've seen some of
there's
those
many things that can do that. So there was another study that was done at Oxford and the University of Leiden in the Netherlands. They teamed up and they did this study where they measured blood levels that measured insulin sensitivity and triglycerides. And what they did was, and people were doing this all throughout the year. And what they did was they looked at the date of the blood tests and they sorted all of these people that had blood tests on these dates and had blood drawn in these cities. And they looked at the previous 7 days and they looked at the weather report and they calculated how many literally hours of sunlight there were in the 7 days leading up to this blood test. What they found was mind-blowing. They found that the more hours of sunlight in the previous 7 days correlated with improvement in insulin sensitivity and a reduction in triglyceride. That correlation did not exist for temperature. That correlation did not exist for humidity. It only existed for sunlight hours.
That's incredible. So we all know now that like sunlight is incredibly important, not only for your mood, but also for, lowering CRP, also for, preventing common respiratory illnesses. And so some other lifestyle factors that may be helpful for reducing the common cold. We talked about sleep, obviously we talked about sunlight. Also avoiding, high sugary foods, because we know that hyperglycemia is something that can, be a risk factor, and also ultra processed food. So those couple things that you kind of mentioned to your patients.
Zinc is another one. So zinc has been shown in a controlled trial to actually be beneficial. The key with zinc is not overdosing. So this is something that we often get into. If a little bit is good, a lot is better. If you take too much zinc, it can actually increase your risk of copper deficiency. Yeah, so just make sure you're not taking too much zinc.
And some other things that may be helpful as well that have peer-reviewed research are garlic and elderberry. Anything else that you may recommend for preventing the common cold?
One thing that's actually been shown to be very beneficial immediately in terms of relief symptomatically, okay, is and this may sound like an old thing that your mom might have told you or your grandmother may have told you, but it actually works, is just putting a pot of boiling water on the stove. And that's something you have to be careful of. You don't want to burn. And it's a slow simmer, putting a towel over your head and putting your nose and breathe in the heated steam. And if you want, and this may sound even more crazy, but it actually does work, is eucalyptus oil. There's actually been some studies on this, that eucalyptus oil is a tremendous stimulator of the innate immune system. They've actually done studies microscopically where they had these little beads that were foreign subjects, and they could light up, and you would see that in the dish. This is all an in vitro study, of course, but in the dish where there was no eucalyptus oil, there was a moderate amount of these beads that were taken up. But in the petri dish where there was a eucalyptus oil put in, these things went out and they just scavenged.
Could that be used, say, through like a oil diffuser? An
oil diffuser, yes. Even just putting the drop into the pot that's boiling the water. Again, you have to be careful that you don't burn your face. This is hot steam. So you have to be careful, maybe stand back. But I have done this myself, and I have had patients do this, and it is they notice almost an immediate benefit. By the way, eucalyptus oil is the same active ingredient that is in Vicks VapoRub, and this goes way back to the 1918 pandemic, almost so much so that the eucalyptus trees of Australia were almost cut down to extinction. That's how much high in demand eucalyptus oil was at the turn of the century back then.
What about using, say, the diffuser or putting on the Vicks VapoRub before you get into the sauna? Would that be helpful?
I don't see why not. They've actually done some studies. So if we're looking at these, what they're known as phytoncides, there's been some studies that have done mostly out of Japan who've looked at this, and mostly looking at something called Hinoki cypress oil, where they actually looked at the immune building aspects of this oil in people that live in the city. So they took these people that live in the city, they took them up into the Hinoki cypress forest, they had them walk around, known as forest bathing, and they measured a number of different enzymes. And then they took them back to a hotel in Tokyo where they infused, using a diffuser, the same Hinoki cypress oil. And they found very similar results to the beneficial results that they found in the Hinoki cypress forests. The one difference, though, which is interesting, is that in the forest itself, the urine cortisol levels were lower than they were when they're in the city sleeping in the hotels with the diffuser. And this would make you think that perhaps that they were getting some sort of relaxation when they were walking around in the forest rather than just being in the city. There was a little bit of a difference there, so that's interesting. But in both situations, yes, infusion of Hinoki cypress oil had these benefits. I just want to mention that this is not specific to just Hinoki cypress oil. Just about all of the oils that we see from certain trees, firs, cypresses, things of that nature, eucalyptus, have this sort of benefit on the immune system. And in many of these cases, they last for up to about 7 days. So walking in a forest, walking into a park, doing that on the weekend can actually have good benefits that could last all week.
And I believe also there was a Cochrane review that indicated that probiotics can actually reduce respiratory infections by about 45%, which is pretty incredible.
Yeah. I mean, Mike, let me just say that the micro gut biome, or the gut microbiome, is a huge Pandora's box that we have just begun to understand. It has so much of an effect on the human body. So I would expect there's going to be a lot more studies that we're going to be surprised about coming out of that area.
And, one thing that's always brought up is like vitamin C, but when you look at the studies, it's pretty weak overall. Like the studies I looked at, when I say weak, I think I see about 8 to 14% reduction. But like when we're talking about zinc, vitamin D, elderberry, the probiotics, like we're getting up to like the 30, 60, 70% range, I think for some of them, so it seems like, vitamin C might be a little bit overhyped. What are your thoughts on that?
I think vitamin C is going to be very beneficial in cultures and in individuals who are not getting vitamin C dietary wise. So I think it depends on the population. If you're getting enough fruits and vegetables things that are high in vitamin C. I think extra supplemental vitamin C is probably not going to be as beneficial. Look, I'm a big believer in these vitamins, but I think that nature has actually packaged these things in the correct way that actually benefit us the most. So vitamin D is packaged in the light from the sun, which has so many other benefits. Vitamin C is packaged in fruits and vegetables in a way that is actually much more beneficial to us. I'll give you an example of what I mean by that. Many years ago, we saw that people with lung cancer did better when they had diets rich in vitamin E and vitamin A, beta carotene, things of that nature. So scientists, reductionist thinking once again, looked at that and said, maybe if we extract the vitamin E, the beta carotene, vitamin A, and we fed it to these lung cancer patients at high amounts, maybe we could formulate some sort of a medication that would help out these lung cancer patients. That study had to be stopped early. Why? Because it was actually more detrimental than it was when you actually had those vitamins being given in a natural way in their natural environment into the human body. So I think that there's a lot of assumptions that we make when we think we see something that's beneficial, we concentrate it and we give it without the other things that it's generally packaged with. And I think sunlight and vitamin D is no exception.
And vitamin E in general, like that has been shown to increase overall mortality when supplemented with, correct?
In lung cancer.
And just in lung cancer, so it's not particularly in the general population.
I'm aware of it in lung cancer. I'm not aware of it in the general population, but I may be ignorant of that study that you're citing. It may be true.
Okay. Do you have just a few more minutes there, Roger?
Absolutely.
Okay. All right. So, I just wanted to get into some basic things that, so people get, the common cold, but they also get symptoms, right? So they'll have like a sore throat. So maybe we'll start there. So for a sore throat, there are a few things that I think can be helpful. I've seen the American Academy of Family Physicians, they recommend actually Advil over Tylenol for a sore throat. Is that something that you would suggest to your patients as well? Or do you also, have to be careful because, hey, you don't want to bring down the fever, And so
again, this is the thing. So gargling with salt water, I think is beneficial. Salt water is a highly osmotic solution, and it's going to draw water out of things, which will reduce the swelling, reduce pain. What are we doing with Tylenol or even, ibuprofen? Ibuprofen is even more powerful antipyretic or fever reducer than Tylenol is. And again, I don't think that the answer here is to reduce temperature. I think the answer is to boost it. And
how about povidone iodine mouthwash, or known as betadine?
I've heard a lot of people who swear by that, and I just haven't seen the studies. It's not that the studies don't exist, but I just haven't seen
some meta-analysis on it that indicate that it can be helpful. Because, and the interesting thing about that is that I think it's good also for viruses and not just bacteria. Because again, from the studies I've seen, in children, it's different. I think about 70% of the time when a child presents with a sore throat, they actually do have a bacterial infection, only about 30% of the time that when they present, they have a bacterial infection. I think it's 10% for adults. So, very, very low. And then we get to, acute bronchitis. It's something like 96% of the time it's actually viral versus bacterial. But just coming back to things that people can take for a sore throat. Are you a big fan of like the lidocaine rinses, or is there anything else that we're kind of missing, like bee propolis spray or anything that people?
Not a big fan of lidocaine rinses, only because there are some side effects that you can have from lidocaine. It's rare, but it can happen. People can get actually methemoglobinemia, which is a situation where you have a reduction in the oxygen carrying capacity of the blood. You could get desaturation. Ironically, the treatment for that is methylene blue. So if you have that around, you could cure that, I guess. But it's rare. Lidocaine also is an arrhythmic too, right? So you have to be careful.
What about honey? Any evidence for honey for respiratory infections or for sore throats?
Oh, I love honey. I remember even before I got into all of this was like 10, 20 years ago, there was some sort of medicine that was like a honey cough. And it's like, man, that is... I remember saying, I almost wish I had a cough so I could take that stuff because it tasted so good. And the honey has actually interesting properties to it that resist bacterial infection. I think that there are some definite studies that show that honey is beneficial for breaking up things called biofilm. Biofilm is the protection that bacteria create to prevent the immune system and antibiotics from being able to break it down. Honey is able to actually penetrate that. There's actually been some studies looking at something called Manuka honey. Manuka honey in things like sinusitis and nasopharyngeal infection. So I think honey has a lot of uses. Probably we don't know half of them yet.
And then for ear infections, it seems to be fairly limited in terms of like, again, you have your typical Tylenol and Advil, which again, we're trying to avoid because, we do want to, that temperature to be risen because it's, part of the body's own immune response. You can have some, topical lidocaine formulations. Would that be safer because it's, through the ears and not through the mouth?
Yeah, I guess it's possible. Again, I as an internist, I don't treat any actually pediatric patients, so I don't have a lot of experience in how this would work clinically in kids. I don't use it in my adult practice, but I'm just ignorant of those things, so I'd have to defer to you on that.
Understood. And then regarding, say, like coughs, which is something that, again, comes up with a lot of people who have, the common cold. Are you a big fan of dextromorphin? Obviously, you're a fan of NAC. We know that. But, anything else that people should know about with regards to, suppressing a cough?
So if you use anything that has the DM, which is dextromorphin, which is like what you said, it's a narcotic, right? So just realize that the way that the narcotic is working is reducing the cough reflex and preventing you from having that cough. But it can have other effects on your system, especially if you're taking other medications. It can slow down your gut. But, obviously, if you need some acute help there, then it may work. I bet you, though, that most of the formulations that you will see for cough will also have things that reduce fever. So just be aware of that when you're taking these medications. And
we know that Ventolin or salbutamol is given out for a lot of people with cough, but I think from the studies that I've seen is that it only is really effective when people have like true shortness of breath. Or do you find that it's effective when people have any kind of cough at all?
Well, there's an entity actually called cough variant asthma, and this is a symptom of asthma that is only a cough. So normally you think of people with asthma of having shortness of breath and wheezing. Some people with asthma, the only symptom that they will have is a cough. And in these situations, albuterol would be beneficial. Even an inhaled corticosteroid might be beneficial.
Okay, excellent. Anything else with regards to the cough, or do you think that we kind of covered most of the things?
Just what you said in terms of NAC. In terms of the symptoms that NAC reduces the most in a winter season when taken 600 milligrams twice daily, the biggest things where there was runny nose, sore throat, and cough. Those are the symptoms that N-acetylcysteine or N-acetylcysteine actually help the most.
Okay. And just a few more minutes there, Dr. Seheult, and then I'll let you go. So excessive mucus, like, are you a big fan of guaifenesin or serrapeptase or anything that, may in fact, break up the mucus or reduce it?
Yeah, I think those are beneficial if the patient notices that that's beneficial. NAC is a great mucolytic. So not only does NAC help with all those other things that we talked about, NAC is a reducer. So if you look at the mucus that you secrete, it's actually these disulfide bonds that make it thick and hard to cough up. What NAC does is it goes in there and chops up all of those sulfide bonds and allows the mucus, which is thick, to become very liquidy and easy to cough up. So I'm a big fan of that.
Because it's a thiol donor, and I forget the name of the drug. God, I forget. But there's one drug that's kind of more used in Japan. I'm just trying to think of what it is now, but it's supposed to be, like 16 times or something the thiol donor than
NAC. Okay.
The NAC is. But I'll have to put that in the show notes anyway.
Sure.
I'm kind of blanking on that one. What about positive expiratory pressure therapy? Is that something that you're familiar with, or something that you find patients find helpful?
Oh, especially in patients who have, obstructive lung disease or asthma, things of that nature, that can help quite a bit, because as they're trying to blow out that air, they have issues with obstruction. And ironically, actually pursed lip breathing or some sort of expiratory pressure that can actually open up the airways and allow them to breathe more easily, especially if they have underlying lung diseases.
Okay. And very last symptom that we'll talk about. So, nasal congestion is also another big one that people struggle with when they get sick. So, Saline irrigation, I find that to be, pretty effective for a lot of people. Sometimes people even use antihistamines. Is there anything that you find to be particularly effective for nasal congestion?
Yes. Unfortunately, the most effective thing that you'll find that works the fastest, of course, is like things like Afrin, oxymetalazone, epinephrine. But these are things that we should avoid because overuse of these will cause rebound dilation. It actually makes it much worse. It's known as rhinitis medicamentosa. That's the Latin term or the Greek term. I don't know which one, but that's the term that happens. So avoiding those over-the-counter medications as much as possible would be great. The ones that I typically go to would be the inhaled corticosteroids, the nasal corticosteroid sprays like Flonase, Nasonex, or the antihistamines like Astelin, Astapro. These used to be prescription only. They are still available as prescription if you need it for insurance purposes to get a cheaper prescription. But they're also available, at least in the United States, they are over the counter. I don't know if they are in Canada.
Yeah, so they're not in Canada, but a lot of people will get Omneris because Nasonex is not covered, whereas Omneris is. So because of that, a lot of people will use Omneris. What about oral decongestants like pseudoephedrine? Are you a fan of that or not so much?
Not so much. We've run into a lot of problems with that in the United States. First of all, there's been a number of studies that show that it just doesn't work. That's number one. Number two, it does increase the heart rate. It works at doing that. And then the third problem, of course, and I'm here in Southern California, which I think is the amphetamine capital of the U.S. These things, if you buy these things, they mark it down. They keep track of how many times you buy these things because there was a time where people would buy this as sort of substrate to make their own amphetamines and their own. So pretty interesting stuff.
Spirulina, I've seen that's been effective for allergic rhinitis, but is it effective if you have a common cold and you're struggling with nasal congestion?
I'm not sure. I don't know how to answer that one. I don't have a lot of clinical experience with that one either.
Okay, got you. Well, yeah, that's, I think, covers most of the major symptoms that people experience when they do get sick or do get the common cold. I think maybe the one thing we didn't cover is sinusitis. Is there anything that we didn't mention here today that you think may be helpful if someone gets a sinus headache?
Oh, those are the worst because those are so hard to cure and there's biofilms involved. So generally speaking, the reason why you have sinusitis is because the airways are not draining and things get backed up. And when things get backed up, they get infected. So it's really important to open those things up and treating the sinus disease first, in addition to obviously taking care of any infections with antibiotics that you may have to do. Realize that there's a side effect to that.
Yeah, there's one. I don't think this is kind of preliminary research right now, and it's more in headache and migraine patients. But I have actually seen one study anyway that shows that green light therapy may actually be effective for migraine patients or headache patients. But I don't know if that would be effective for a sinus headache. I'm not sure if you have any comments on that.
No, those may be different. So what I typically will distinguish in my clinic between migraine and sinus headache would be if they tip their head forward and down, the pressure of the blood will increase the pain. And that's a good sign that what you're dealing with there is a headache that's related to sinus pressure. If that's the case, then you really need to work on the sinuses. And that would include anything that reduces the inflammation, because when you have inflammation of the mucosa, it's going to close off those tunnels that allow all those areas to drain. So reducing the inflammation, allowing drainage, these are things that are going to help your body to get over that sinusitis. Of course, antibiotics, if they are used, will need to be used for weeks because it's very difficult to treat infections typically in the sinuses. They tend to come back.
Amazing. Well, you've shared a ton of knowledge there today, Dr. Seheult. Thank you so much for coming on. Can you please let people know, about your MedCram channel? Please put out all your socials and anything else that you're working on right now.
Yeah, so on YouTube, we're just simply MedCram. We have videos there that talk all about sort of the stuff that we've been talking about today. For those that are interested in getting continuing medical education credit, people who are professionals or even not, we have a lot of courses on things that you may have as a disease or may know someone that has. Go to our website at medcram.com. I'm also on X as well, so you can find me there.
Awesome. And I think you have an upcoming podcast with Dr. Huberman, or I think he mentioned that on X. Or
yes. Yeah, so that's going to be, we'll be recording that on February 5th, and we'll see when it comes out.
Awesome. Well, again, thank you so much for coming on today. I learned a lot I bet everyone who listened learned a lot too. Obviously you have a ton of knowledge, about the red light and sun and the saunas and cold exposure, and gave us so many different protocols that we could use. So thank you so much again for coming on, and as always to everyone, I'll be back again with another episode soon.